Hello everyone, welcome to another video. So in this video we'll be treating a very unique topic known as cervical spondylosis. So you might be wondering, what is cervical spondylosis? The name sounds so much, like the grammar sounds a lot. So let me break it down. So cervical spondylosis is a condition that particularly affects the neck. So it's, in simple terms, it happens when the bones, the discs and the joints in the neck wear out over time. So it's like how the soles of shoes wear out if you use them for over years. So if you use them for years, so it's the same thing. So this wear and tear can lead to symptoms like neck pain, stiffness, and sometimes nerve problems. So looking at the background, the neck is basically part of the spine, specifically the cervical spine. So the cervical spine is made up of 7 bones from C1 to C7, which are basically stacked on top of each other. So between each bone is a disc which acts like a shock absorber. So it acts like a shock absorber, like cushioning the bones during movement. So with age or overuse, the discs may shrink, dry out, or they may break down. So the bones may grow small spores, that is like extra bony projections known as osteophytes, and the ligaments may thicken and stiffen over time. So this breakdown leads to this condition known as cervical spondylosis, which is extremely common after the age of 40. So it's more common in elderly people after compared to younger people. So looking at the anatomy, so we have the vertebrae. The vertebrae is basically it contains 7 bones in the neck that protects the spinal cord and supports the head. Then the intervertebral disc, so they are soft jelly-like cushions between the vertebrae. Then we have the facet joints, which are small joints at the back of the neck, bones that allow movement. Then we have the spinal cord, which runs through the center of the vertebrae and sends messages between the brain and the rest of the body. Then the nerves that exit from the spinal cord through the openings to supply the arms and the upper body. So looking at the physiology, the cervical spine basically allows flexibility, that is the turning, the bending, and the nodding of the head. So these discs they absorb pressure and maintain spacing between the vertebrae to prevent bones from grinding on each other. Like I said, it's like a shock absorber. Then the nerves, they control sensation and movement in the shoulders, arms, and hands. So what exactly causes cervical spondylosis? Number 1, aging. So generally, the natural degeneration of the bones of the body usually starts as early as age 30. And then another cause is like repetitive neck movements. So jobs that require neck strain, like desk work or like all those lifting kind of jobs. So they can cause this due to like the repetitive neck movement, they can cause this cervical spondylosis. Then when there's a history of like previous neck injury, and also genetics too plays a factor in it, like if it runs in your family, there's a chance of you getting it too. Then smoking, which usually speeds up disc degeneration. Then also sedentary lifestyle too weakens the neck muscles. So these are basically the causes, like what could cause the cervical spondylosis. So looking at the pathophysiology, what exactly is going on inside the body when somebody has cervical spondylosis? So the discs that are between the vertebrae, so the discs, they lose water content and become flatter with age. So this is usually called disc desiccation. So the space between the vertebrae narrows, increasing friction, and the body tries to fix this by growing something known as osteophytes, which are bone spurs. But these osteophytes, they can press on the spinal nerves or even the spinal cord, and when these nerves are compressed, it leads to pain, numbness, or weakness in the shoulders, in the arms, or in the hands. So what are the signs and symptoms that a person would have if they get if they have cervical spondylosis? So for example, there will be neck pain, like it will be dull or it will be sharp. Then there will be neck stiffness, especially after sleeping or sitting somewhere for a long time. Then headaches too, starting from the neck base. Then there will be a like usually with neck movements, there will be something like a grinding or a popping sound, which is known as crepitus. So with neck movement, you might hear this sound. Then there will be radiating pain to the shoulders or the arms, and there will be numbness or tingling in the hands or the fingers, and there will also be weakness in the arms if the nerves are affected, and there will also be loss of balance or coordination in severe cases affecting the spinal cord. So other conditions that may look similar to cervical spondylosis, for example, we have cervical disc herniation. So the disc bulges out and compresses a nerve. Then we also have a condition known as fibromyalgia, which is widespread muscle pain, which includes the neck. Then also rheumatoid arthritis, that is an autoimmune disease causing joint inflammation. So we can also see similar symptoms with rheumatoid arthritis. Then some tumors that affect the neck too could cause neck pain, and also another condition known as carpal tunnel syndrome. So if cervical spondylosis is affecting the hands, so we could see like similar signs with the signs we see in carpal tunnel syndrome. So looking at the diagnosis, first a clinical history and a physical exam is done. So we check for the patient's symptoms, how long it has started, how long they've had this particular condition that is affecting them. We also have to check about their lifestyle, like do they do more of sedentary work, do they do more of lifting. So all these questions we'll ask the patient, and we'll try to get their medical history. Then we do a physical exam too of the neck, so just checking if there's presence of neck stiffness, if there's presence of neck pain. So x-rays too can be done, and in x-rays we can see the presence of bone spurs and narrow disc spaces. So x-rays, then MRIs, which will show nerve and spinal cord compression, then CT scans too, which help to show better bone detail, and also electromyography can be done, which tests for presence of nerve damage. So for the treatment of cervical spondylosis, the first line treatment, the non-pharmacological first line treatment, so we encourage the patient to rest and try to do posture correction. So if there's a particular way they are always sitting, if there's a particular way that they are always, if there's a particular thing that they are doing that is straining their neck muscles, we advise them to try to change their posture. Then physiotherapy too, like stretching and strengthening the neck muscles, and also using heat or cold packs to relieve the stiffness or the inflammation, and then use of a cervical collar temporarily for like the neck support. Then when we're looking at the pharmacological treatments, like with giving them medications that could help, so we could give them pain reliefs like pain relievers like paracetamol for in cases of mild pain. And then NSAIDs like ibuprofen, diclofenac for severe pain and inflammation. Then muscle relaxants too, for example cyclobenzaprine to help with spasms. Then also for the neuropathic pain, like pain from the nerves, we can give agents like pregabalin, gabapentin if the nerves are affected. So we usually know the nerves are affected if the patient has numbness in the hands or in the legs. So when the patient complains about this symptom, we'll give this pregabalin or gabapentin to help with the symptoms. Then topical analgesics too, like methyl salicylate creams or capsaicin can be given to. And for severe pain, we can give steroid injections, but it should usually be given in short term. So in rare cases, surgical options can be advised, like especially if the case is very severe. So when there's severe nerve compression or spinal cord involvement, we usually advise for surgery, and procedures like discectomy, that's removing a damaged disc, can be done, or procedures like spinal fusion too. So how, like somebody that has cervical spondylosis, how do they manage this condition, or what lifestyle advice would be recommended to such a patient? So for example, the patient has to first learn posture training. So the patient has to continuously try to keep the neck in a neutral position. Don't be slouching very often, because most of the time slouching usually puts pressure on the neck. So we advise them to practice posture training, and then avoid carrying heavy bags on one shoulder, because when you carry heavy bags on one shoulder, it's like you are putting so much pressure on this side. So we try to tell them to avoid carrying heavy bags, especially on one shoulder. Then exercise regularly. So focus on neck exercises and upper back exercises, and then try to have a healthy diet and hydration. So usually the health of the disc that acts like a shock absorber, it usually depends on how hydrated the person is. So water is very important, so try to be hydrated. And then we also advise the patient to quit smoking, because smoking usually accelerates disc degeneration. So quit smoking if the patient smokes. Then weight management too. So extra weight usually strains the spine, so we try to advise to manage their weight if they are obese, or if they are if they've put on a lot of weight. So cervical spondylosis is chronic but is manageable, and most people improve usually with non-surgical treatment. So surgical treatment is usually like the last option, and it usually comes when the case is very severe, it has really damaged the nerves. So that is when we look at surgical options. So however, if this condition is ignored, it can eventually get worse. So it's better that if we start noticing all these symptoms like neck stiffness, neck pain, so if we start noticing all these symptoms, whether it's like a dull pain or whether it's like just we should try to correct our posture, and if it's we should try to correct our posture. And if it usually gets to the point where we start seeing other major damaging effects like numbness, tingling, so we usually advise that they seek medical advice. And yeah, like when we notice symptoms, when we notice certain symptoms in our body that is different from the normal, it's better not to keep it at bay or ignore it just because you don't want to go to the hospital, you don't want to go to the pharmacy, you don't have the time. So most of the time when we ignore all these signs, like these early signs of, like, the body always has a way of warning us like there's an issue. So when we ignore these early signs, we usually make the matters, like make the condition worse, because by the time you are forced to now go to that hospital or go to that pharmacy, to be the time when the body is sending you last minute signs. And usually last minute signs, they make you not even function properly. So it's better to like have early management and early treatment. So that is it for this topic. See you in the next video. Bye.